Thank you for joining for this month's meeting of CTeL's Telehealth Working Group. There's a couple topics and opportunities that I wanted to review since the last time we've met. First is some activity leading up to the proposed 2027 physician fee schedule and some of the potential telehealth policies that may be included, as well as over the weekend, some updates in terms of the FDA's actions regarding mifepristone and prescribing, and then a couple funding opportunities through HRSA that may be relevant for some folks in the CTEL network, and then typical member discussion, as well as an upcoming event later this month. So on the 2027 physician fee schedule, this is an annual rule that CMS initially proposes, typically in early July. The specific date varies based on how quickly the agency is working on it, but it's usually sometime in the first half of July. And this sets a lot of payment policies for physician services under Medicare, and also has a lot of influence on how other payers set up their fee schedules as well. So it's a pretty big opportunity to have input on some of the major policy issues at hand when it comes to Medicare payment. Um, Over the past month, a couple House committees have been considering legislation to reform some aspects of the physician fee schedule. These are particularly aspects that CMS is unable to change due to previous congressional mandates. One of the big ones would be reforming the CMS budget neutrality requirement, which requires that any changes to the physician fee schedule beyond a certain limit be offset by either cuts in other areas. So, for example, if CMS adds a new code, that the increased payments for that have to be offset from cuts elsewhere. Typically, this happens through cuts in the conversion factor, which applies to services across the physician fee schedule. Additionally, the proposed legislation would also introduce a stabilizing factor for the conversion factor. And the version that was passed out of the Ways and Means Committee would limit changes to the conversion factor by no more than 2.5% in either direction in any given year. And as I mentioned, this passed the House Ways and Means Committee 44-0. So that was a unanimous vote. Um, and there was also a hearing from the House Energy and Commerce Committee also last month around the same time. On the right is a screenshot of the bill that would implement a lot of these changes. They're calling it the Provider Reimbursement Stability Act of 2026. Also, likely coming in this year's fee schedule and other related rulemaking is CMS implementing new modifiers that Congress mandated in the funding bill passed in February that reopened the government and extended telehealth flexibilities through the end of 2027. CMS Congress mandated that HHS create two new modifiers for two specific kinds of telehealth services. The first being services provided by telehealth that are billed incident to a physician service, as well as services provided by telehealth through a fully virtual platform. And this is due to Congress having certain concerns about overutilization or payment integrity issues um, surrounding these two specific kinds of billing. And so these modifiers are being implemented to give Congress and CMS more data on the prevalence of these kinds of billing. Any questions on this?
Not from me, no.
I also wanted to highlight over the weekend that the FDA had officials from the FDA stated that they have been conducting a safety study of mifepristone. That this has been going on for months now. Um, However, the efforts have recently been accelerated especially given the ouster of the now former FDA Commissioner Marty Makary, who has been receiving increased pressure from lawmakers, from Secretary Kennedy himself, as well as a number of groups to take stronger action against mifepristone access. Um, and specifically, what's likely to be targeted through this study is telehealth prescribing, as well as mailing of the drugs as well. CTeL sent a letter to the FDA back in October, focused more so on reaffirming that telehealth is held to the same standards of care as in-person care, and that telehealth is a clinically valid means of evaluating and prescribing medications to patients, and that telehealth as a modality shouldn't be targeted in these efforts. And so this is something that it's still expected to take another 6 months or so before any conclusions come out or the FDA takes action on it. But this is something that officials from the agency have announced that they will be accelerating in the coming months. Any questions here?
Nope.
Lastly, I wanted to highlight two funding opportunities available through HRSA. The first being a Telehealth Nutrition Services Network grant program with awards up to $300,000 to create networks that improve access to quality healthcare services through telehealth, specifically nutrition services to help prevent and manage chronic disease, as well as a grant for technology-enabled collaborative learning programs with awards up to $475,000. And these would be to support the use of technology-enabled collaborative learning to improve retention of healthcare providers and increase access to healthcare services in rural and underserved areas and populations. And applications for both of these grants are due on July 8th. If either of these are something you're interested in applying for, we'd be happy to help advise on how you might be able to go about doing so. Any questions here?
No, I was really looking at that telehealth nutrition grant. I don't think it's going to fit what we do. We're applying for a couple other nutrition grants, so this one isn't going to work for us, but there's definitely interest in the technology-enabled collaborative learning. So,
For sure. And I know the administration has been making a lot of updates to how it evaluates and awards grants as well. And so that's something that we've also been monitoring, even though many grants are still available. The administration is looking to update its methodology for evaluating them.
yeah, it's a really short turnaround time
Hmm.
because they kept kicking the can down the road with these two. I was watching them for months.
Yeah. Any other topics in telehealth or digital health that we didn't cover today? Either questions or comments or topics? If not, of course, you're always welcome to reach out to me if you have any questions or would like to set up some time to chat. Our next event coming up is our Digital Health Market Symposium held in New York City this year. This is an in-person event focusing on the market aspects and trends shaping growth and investment in digital health. We have a pretty big speaker lineup for this, and we'll be hosted in collaboration with Nixon Peabody. Registration is available on the CTeL website. And with that, that's all the content and discussion I have for today. If you have any additional questions or comments, feel free to let me know. Otherwise, I hope you have a great rest of your day.
Awesome. Thanks so much, Lydia. Have a good one.
You too.
Bye.